I had called to find out how soon we were going to know if we were going to get the results. And they said, well, as a matter of fact, it's basically done. All they have to do is go home and cut out the little pictures of the chromosomes and match them up. He said, so we can't tell you today, but we'll be able to tell you in the morning.
In the genetic material that a mother and a father combine when they conceive a child, there's a set of instructions for building their baby's body. There's also a timetable that goes with the instructions. We call that timetable, that schedule for the baby's physical growth, the biological clock. Every now and then, an abnormality creeps into the genes and upsets the timing of the biological clock. It disrupts the building of the baby's body. Deformity and retardation may result. Today, we're learning a great deal about genetic abnormalities, but that knowledge imposes tremendous burdens. What happens if something's wrong with my genetic makeup? What options do I have? In this program, we'll learn about genes, about genetic testing and counseling, about what happens if there is an abnormality. We'll see how far genetic research has come and where it seems to be going. We'll also get to know a young couple who has felt the full impact of genetic information. At one point, they had no idea of what they were dealing with. Then they and their families found out. For the sake of privacy, we'll call the subjects of the story Don and Karen. Don and Karen's story began when they decided it was time to start a family. They were finding it hard to get pregnant, but there was something else that troubled them.
We were hoping to have children, and my sister had a daughter, and she had some abnormalities. She had a patent ductus, which is hole in the heart, which did not close. It failed to close by itself as they normally do. So she had to have surgery with that. With her abnormalities and this patent ductus problem, we were looking at my brother, who also had this problem. He's younger than myself. And he had a problem with his patent ductus, and he was mentally retarded. And we thought, well, maybe there's a connection here that maybe we should look at.
Fearing what they might find out, yet wanting to know, Don and Karen went to a physician who specializes in human genetics. His name was Donald Rucknagel.
Don has a brother who is severely retarded and is institutionalized, and then his sister has a daughter who is likewise severely retarded. And that was the primary thing that brought them to us. So the first thing that we then did was to take a family history, and that precise family history, that kind of a history, suggests indeed that there may have been a chromosomal abnormality.
A chromosome is a strand of the substance DNA, which contains the genetic information for building a human body. Every cell in the body contains 46 chromosomes, the total genetic package. Each chromosome, in turn, is made up of thousands of smaller segments called genes. Picture a long, thin chain. That's a chromosome. Now picture thousands of sections in the chain. Each one is a gene. Don's family history suggested something abnormal about his chromosomes. The next step was a blood test. Dr. Rucknagel describes the process.
A drop of the blood is spread into a very thin film on a microscope slide, and you can then see the chromosomes. Now, a good technician can sit and peer through the microscope for an hour and count the number of chromosomes in a cell, and can count all those 46 chromosomes, and can pretty much, just looking at the field, tell whether there's an abnormal one among 46. But to document this and to convince the world of that interpretation, they photograph that field with that collection of chromosomes in it, make an enlargement, cut out the very individual chromosomes, array them, and paste them onto a piece of paper, arrayed according to size.
The paste-up of Don's chromosomes told a story.
It was clear that there was a chromosomal translocation, whereby in the simplest case, a portion of one chromosome breaks off and is then transferred, stuck on to some other chromosome.
The misplaced piece of chromosome had been passed on for generations in Don's family. His niece and his brother had suffered the consequences. Others in the family carried the disorder in their genes, though there was nothing else abnormal about them. Still others were completely unaffected. Don was a carrier. The abnormality was hidden in his genes, in what geneticists call his genotype, but it was not evident in what they call his phenotype. From looking at Don, you could never tell there was a problem. What about the process of feeding that information back into your family? How did that go? How did your family react?
That was rather touchy because my mother had a very strong guilty conscience of my brother, thinking that she was the reason that he was mentally retarded. And then she was even further on a guilt trip, if you will, because her granddaughter had shown up to be the same type of a problems. And she's going, well, this has got to be my problem. And she was very upset. And after we let them know that, no, we have a way of preventing this, and that I am a carrier, that my sister's a carrier, they began to take it in stride, and they kind of understood what was going on.
Mm-hmm. And was it actually true that you're on your mother's side, that was where the carrying of this trait was? Or?
No, it was not. And that was the interesting point.
Wait, so your mother all this time has been feeling guilty?
Correct.
About passing on something she wasn't passing on at all?
Correct.
How did that information hit her?
It was like a whole new lease on life. She was just elated.
So the family story changed, and with it some powerful feelings. Don's mother was relieved, but now he carried the burden of knowledge.
Well, when we found out that I was a carrier, it was kind of rough for a while because we were thinking, well, then we're probably going to have to make alternatives, adoption or artificial insemination. And I was not very supportive with that. I was feeling guilty. I was upset.
You wouldn't talk.
I wouldn't talk.
I felt the need to talk about it and plan for the future. So we have this information, we've got to make decisions. He didn't want to talk about it.
It was to the point where I said, I really don't want to have any kids, period, if we're going to have to go through all this.
So for a couple months, things were a little rocky. You know, I had to keep telling him, it's not your fault.
It was like getting over the shock.
I mean, that there's a real burden there that you're carrying. I mean, you're the carrier, but you're also the cause of her
Yes,
grief.
because I care for her very much, and it was because of me and my genetic problem that she would have not only this grief of possibly having to terminate a pregnancy, but she wanted a child very badly. But then we talked it over, and we got our emotions together, I guess.
Yes, and it was shortly after that I found out I was pregnant. And I thought...
Talk was just in time.
Yes. And then when I found out I was pregnant, we were happy. And I guess we were pretty optimistic.
Maybe too optimistic.
Yes.
Because we
And we
kept
just-
saying, oh, let's plan for this and plan for that.
And we just, you just never think it's going to happen to you.
Don and Karen had crossed one bridge in learning about Don's genetic makeup, but another bridge lay ahead. It's difficult to deal with all the facts, choices, and burdens associated with genetic information. People often get help from specially trained genetic counselors like Diane Baker. Genetic knowledge, she says, affects everyone. You have to learn to keep it in perspective.
When any one of us gets up in the morning and decides to get in our car and get out on the public highways, we've taken a certain risk that we might be involved in a serious or crippling accident. And yet, although we don't walk around consciously with the idea in our mind, what is that risk? It's something we are aware of and we just accept. Well, when any healthy young person undertakes a pregnancy, there is a baseline risk that there could be an abnormal outcome, a baby with a significant birth defect, and I'm not saying something minor like an extra finger or club foot, but something very significant involving shortened lifespan or mental retardation. And the risk of that is about 2 to 3% for every pregnancy for any healthy young couple.
Genetic counseling is helpful for prospective parents like Karen and Don, but people at other points along the life course are also affected by genetic conditions.
I think you can look at genetic counseling and the services that go along with it as subdivided into 3 areas clinically. They're basically age-related. One that I think is most visible is prenatal diagnosis. That I would call one category. Second category is pediatric genetics. And in pediatrics, that's the child who's born with significant birth defects or the child who's born apparently healthy, and then later in childhood, their development starts to decline or concerns are raised about whether or not they actually have a genetic condition, and they're evaluated and found to have a genetic condition. So that's a second area. A third area would be what we might call adult onset conditions. For example, Huntington disease, presenile dementia, some neuromuscular problems, which really have their expression in adult years.
And do you guide people along the decision-making path?
We are very concerned about what we would call being directive with the information we give it. We really strive to give it in a very non-directive and neutral way to allow people to explore how that information fits in with their own values and their own life experience.
When Karen discovered she was pregnant, she and Don worked with Dr. Rucknagel in reaching several decisions. The first was to undergo a test to determine the status of her fetus. The test is called amniocentesis, and it works like this. A needle is inserted into the womb where the fetus floats in a sac of fluid. The fluid contains cells shed by the fetus. Sample fluid is withdrawn and the cells are analyzed to detect abnormalities. For example, Down syndrome, a condition caused by an extra chromosome, is usually detected with amniocentesis. The earliest amniocentesis can be done is 14 weeks into a pregnancy.
The first time they were not successful, so I had to wait an additional 10 days, and I went back in, and they got the fluid the second time. And we waited, it was pretty close to 5 weeks, I think.
To the limit.
The hardest part for me was the waiting, the being pregnant and not knowing. And I think it was the day after Christmas, we got the call from Dr. Rucknagel, and it was not good news.
Karen had the amniocentesis a few weeks before Christmas. And so she went through the Christmas holiday with the uncertainty of not knowing what the outcome was. And I called her and told her that the chromosomes were unbalanced in that fetus and that it was destined to be a child with mental retardation.
And the thought kept crossing my mind, maybe I never will get pregnant again, because we didn't really know what was keeping me from getting pregnant. And then, just out of the clear blue, I'm pregnant, and I kept thinking, maybe this is my only chance. And that bothered me a little bit, thinking, maybe I should go ahead and have the child, because it could be the only one I'll ever have. But when the time came, we felt we made the right decision for us, which is not necessarily the right decision for someone else, but it was the right one for us.
The decision was to terminate the pregnancy.
If the fetus had been a carrier, then we were going to go ahead and go full term and have the child, but we did not want to have a child that we knew would have physical deformities and be mentally retarded.
Karen found that others had a hard time with their decision, her family in particular.
They were not supportive when I was pregnant. They just couldn't accept the information. And my mother kept saying, there's no way that you will terminate your pregnancy if you get bad news. There's just no way. I know there's not. She didn't tell anyone that I was pregnant. She didn't even tell my grandmother I was pregnant. She didn't tell anybody. And when we called and said it's bad news and I'm terminating the pregnancy, she just couldn't believe it. She did call to find out how I was doing afterwards, but then dropped the subject.
Karen herself could not drop the subject.
I just took a short period of time off work after I terminated my pregnancy, and when I went back to work, everyone acted like things should be normal, like nothing had ever happened. And I was definitely mourning, and I think people were very uncomfortable with it because it's not like I just lost the baby, I had a miscarriage. I willfully went in and terminated a pregnancy, and I think that it was hard for people to deal with it. And I think some people think it was the kind of thing you go in and you're knocked out and you wake up and you're not pregnant anymore, and that's not the way it was at all. They induced labor, and I was in labor for 10 hours, and I delivered a child. I was awake.
As a counselor, Diane Baker has helped people like Karen deal with the choices they've made. This includes those who get unwelcome test results and still choose to go full term with a pregnancy.
We very definitely get couples who want to utilize the testing procedure and would not consider terminating a pregnancy, and for very good reasons. They might simply want to utilize that information to prepare themselves both emotionally as well as to prepare their physicians for a healthy and safe labor and delivery and neonatal course for a newborn who's going to have medical complications. For instance, a couple who finds out they're going to have a child with Down syndrome and wishes to go ahead with the pregnancy, they would get a tremendous amount of support if that were their decision from our entire staff, and it would allow us to properly prepare them for the child's birth, for them to prepare their family, maybe other siblings at home. And a child with Down syndrome is at approximately 50% risk to have a congenital heart defect. We want to be sure that that woman delivered at a medical center with a pediatric cardiologist, with a neonatal intensive care unit.
As she's watched people struggle with genetic information and as she's helped them along, Baker has learned something.
I really believe in informed decision making. I really believe that people can utilize information no matter how unfamiliar they initially are with the terms or with the concepts. They can learn it. I believe that everyone can learn it regardless of their educational level, and they can decide how to utilize it and how it applies to their own lifestyle. I really firmly believe in that, and I believe in people having the opportunity to explore that and how they're going to use information. And I also believe that no one really knows how they're going to act on information until they're in the situation where they have to act on it.
In the future, there will be even more genetic knowledge to act on. New discoveries, new tests, and of course, new questions. First, a new test that involves what's called the chorionic villus. The test provides a close-up view of chromosomes at an earlier stage of fetal development. Dr. Rucknagel.
The chorionic villus is a portion of the placenta. It is possible to insert a plastic catheter into the placenta parallel to the wall of the uterus, and then to apply a little negative pressure, thereby sucking some of these villi or fingers, they're finger-like projections, into that catheter, and then pulling the catheter out with these little villi attached that have been sucked into the catheter. The villi are composed of fetal tissue. They are actually dividing so rapidly that their chromosomes can be looked at without culture. They can be done immediately. The two advantages of a chorionic villus biopsy are that it's done between 9 and 11 weeks of pregnancy. The other advantage is that the parents don't have to wait for 3 weeks to get the result back. They get it back the next day or in a day or two.
Just as explorers once mapped geographic locations, scientists are now mapping genes. With a map, we would know the exact position of specific genes responsible for inherited disorders. Mapping is like searching for a needle in a haystack because many diseases relate to just one abnormal gene nestled among tens of thousands.
The most striking example and most successful example of this has been Huntington's disease. Huntington's is a condition. It's a progressive neurologic disease inherited by a single abnormal gene. The average age of onset is 37, so people frequently will start their families not knowing whether they really have the gene or not. They know that they might be at risk of having a gene because they had a parent who died of Huntington's.
So the implication of all this is that with regard to Huntington's, you can do what?
What one might do then is to use that genetic variability to then determine who in the family is carrying the Huntington's gene, and also to determine on amniocentesis whether the next generation has the Huntington's gene or not.
Scientists have also discovered the location of genes responsible for other disorders, including cystic fibrosis and sickle cell anemia.
Sickle cell anemia, of course, is prevalent in people of African ancestry and where Africans have moved in the world. Duchenne muscular dystrophy, now that's a very severe disease in which children with it generally die before they're teenagers or at the end of the teens, early 20s. Another one that in a high proportion of the families is now diagnosable is hemophilia.
But finding abnormal genes doesn't mean we can fix them, at least not yet. Scientists are also exploring what's called gene replacement therapy, an experimental process whereby good genes are grown and substituted for bad ones.
The one thing that we do that, as humans, that's unique is think and solve problems and manipulate our environment. And so we now understand life at a much, much finer level than our grandparents did, and that all of the rest of the human species before did. That has given us some predictive power. It's given us some manipulative power, not all good. But on the other hand, as an academician, I derive great pleasure from understanding where we've come and whither we're going.
While genetic research goes on, so do the lives of couples like Karen and Don. For all the hardship of their experience, it had a beneficial effect.
It really brought us closer, much closer together, and we did open up and talk about it a lot more. And the result was the second pregnancy.
Had you been in touch with the genetic counseling clinic during that interim period?
Off and on. And I called and let them know that I was pregnant again. And there's two pregnancies. I mean, there's before you find out from the amniocentesis and then after.
They feel very different?
Oh, yes.
Okay, tell me how they feel.
The first half, well, it's not really half, but the first part of the pregnancy, you know you're pregnant, and in my case, people could tell I was pregnant, but I never thought past the amniocentesis. It was, I'm not going to buy any baby clothes, I'm not going to get a crib, I'm not going to do anything till I know everything's okay.
Once again, it all came down to a phone call.
I had called to find out how soon we were going to know if we were going to get the results. And they said, well, as a matter of fact, it's basically done. All they have to do is go home and cut out the little pictures of the chromosomes and match them up. He said, so we can't tell you today, but we'll be able to tell you in the morning. So all night we knew that we were going to find out in the morning. And she said, we'll call you probably around 8:30. We set the alarm to make sure we'd be awake.
It was a moment of tension.
And you really had no inclination as to...
No, we
the
had
results would be.
hope. We had hope. And
Well, when I had talked to the nurse, I tried to read into her voice whether it was good or bad. And she said, I got good news.
That did it.
that was it.
Yep.
That was it.
Terrific.
She just said, everything's fine.
Everything's fine, and the baby wasn't...
Not even a
was-
carrier.
Not even a carrier.
Perfectly normal.
Perfectly normal child.
And then I asked the sex
Yeah. She wouldn't volunteer it, so we had to ask.
because we wanted to know. I thought if any human being knows, then I'm going to know. So we found out it was a Friday morning. We started planning and we started coming up with names because we knew we were going to have a boy. And Then we knew.
Knowledge of a tiny chromosomal abnormality has had a profound effect, not only on Karen and Don, but on both of their families. On their families' understanding of what happened in the past, on their beliefs about who they are in the present, on the children they will have in the future. The biological clock that programs the development of a human baby is a complex and delicate mechanism. The more we know about its genetic component, the more we're able to predict the lifelong consequences of certain flaws, the more we'll be faced with the burden of choice. Few of us will ever experience that burden the way Karen and Don have. In their lives, genetic knowledge has had the power to devastate, but also the power to relieve and bring joy.
And I also believe that no one really knows how they're going to act on information until they're in the situation where they have to act on it.